to the Walton Centre Annual Members Meeting for 2020. This is the first, I feel a bit like the Queen actually, this is the first live broadcast of this Annual Members Meeting. Usually it's held face to face with tea and cakes and other things to keep us amused, but this year it's just being all done remotely, as are most of our meetings at the moment. Just a couple of formalities before we get into the business of the meeting. The minutes from last year's annual members meeting have been confirmed by the governors and will be available on the Trust's website after this meeting if anybody wants to read them. Also, we did ask for questions in advance of this meeting that we could answer as we went through, but none as yet have been received. But as we go through today's presentations, you might have other questions that you want answering, so they can be sent after this meeting to the address that you've already been given, but I'll repeat it. It's membership, all one word, at thewaltoncentre.nhs.uk, and unfortunately that's the only way we can get questions answered in this particular meeting. So I will reiterate it at the end of this meeting. So thanks for your patience on that. So to set the scene, as I said, last year's annual members meeting was held face to face in our Sid Watkins building. Quite a lot of fun, tea, cakes, and we just celebrated our second CQC outstanding, and it was a really great event, and we were on a real high. It was business as usual. We were looking forward to a busy winter, and the worst case scenario on our horizons at that time was that we'd have a flu pandemic, and that would affect, the way we were able to treat patients. Well, little did we know. The first signs of trouble were in, can I have that next slide, please? Thanks. The first signs of trouble were in January and February, and I've still got a note of the first phone call that I had to say we had our first positive COVID patient, and that was going back to February this year. I don't think any of us could have anticipated the speed at which it tore through the country. And you'll see on that slide in front of you the timeline of how quickly it went from the risk level raised from moderate to high on the 12th of March through to lockdown on the 23rd of March. I think it's fair to say it has changed most people's lives. It's touched everybody's lives, and it's changed immensely the way that we've had to treat our patients. We hoped we were going to get back to some form of normality as we came into this winter. Unfortunately, it looks like we're going to hit another wave. It's difficult to predict at the moment, but it's certainly in our planning at the moment that there will be a second wave, and how we can continue to treat our patients. Because as probably most of you are aware, we've been asked to get back up to 80% of capacity in this next month. That's based on the patients we treated last year, but of course we're running at a much slower pace because of the impact of COVID and having to take additional precautions. So that's the context I want to set where we are at the moment in, before I hand over to the executive team to talk you through some of our response to that, but also to talk about some really positive things about strategy, what we've done this year, the very positive things about what's happened, because I'd hate to just dwell on the negativity of COVID, because it's touched everybody's life, and I think really everyone is well aware of its impact. So I'll hand over to Hayley Citrine, Chief Exec, to talk us through some of our service delivery response and the way we work. Hayley.
Thank you, Chair. So as Janet has said, my name's Hayley Citrine. I'm Chief Executive here at the Walton Centre. And I think normally in our annual members meeting, we look forward to reflecting on the previous year, and where we've done well, what we want to build on going further, and it's really an opportunity to celebrate. This year, as Janet has outlined, we're in a very different situation. I don't think any of us would have predicted what would happen. Literally in January, we were in a completely different place. So it seems pertinent to not only reflect on last year, but also to reflect on the changes that have been put in place in relation to healthcare in the Trust, in relation to COVID-19 that really occurred during the last quarter of the last financial year. So we thought we'd share with you some of the new ways that we've been working. So we've held in the month of August over 2,653 appointments virtually for our outpatients, meaning that we needed less patients to be able to travel and come into hospital, which obviously in itself is a risk. It's another gathering and an area where we wanted to reduce that. We are still holding some face-to-face clinics where we need to, and that is the right thing for the patients. But wherever possible, we're using Attend Anywhere, which is basically a video link. We've also got over 400 staff working at home, and again we did this in a period of over a week. This is a third of our staff, so not insignificant for a small trust. We increased our critical care capacity, so the beds available by 33%, recognising that what we'd seen in London, who were a few weeks before us, this was the area of need in particular. We also increased our psychological support for our staff and for our patients, and our team of psychologists were key to undertaking this. I think it's been well documented that the impact of COVID and the changes made and the reduction in people's coping mechanisms has had a detrimental effect on everybody's mental health, and it's important that we look after people who are looking after people. We transformed 6 out of our 7 wards into caring for COVID patients, and we did this by coding the wards in different categories in relation to risk in response to which bracket each of those patients fell into. And we began a programme of restore, prepare and transform, transforming our services so that we're able to be fit for the future, because I think regardless of the uncertainty around COVID, what we're aware of is this is likely to be around for some time. Can I have the next slide, please, Carol? Thank you. So in relation to service delivery response, I talked about the virtual outpatients. So if you could just click that again for me, Carol, it just has some further information underneath and for each of these slides. I think that's the case. I'll just wait for that to drop down because I can take a couple of minutes. So basically, we implemented Attend Anywhere, which is a virtual platform that allows us to undertake outpatients. We also made sure that we utilised over 600 of these, I think, in July. In relation to reconfiguring our wards, we managed to look at how we would categorise the patients who needed elective procedures that were had a negative COVID test, alongside separate wards for our patients that were at high risk of COVID or awaiting a screening test, and separate again would be the patients that were already COVID positive, ensuring that the correct infection prevention and control procedures were in place for each of those. As I alluded to a moment ago, the ability to increase our critical care capacity was also really important, and that we were able to flex that capacity as we needed to. So using some of our recovery areas, moving our day case area to a different area, and also supporting the Cheshire and Merseyside system. So not just taking patients who needed critical care for neurological conditions, but also taking patients that require critical care for COVID status alone or other complex medical conditions, and they were also positive for COVID. And that required quite a fundamental change in some of the training that we undertook with our anaesthetists, with our surgeons, with our nurses, with our AHPs, with our neurologists. We also transferred patients that required head and neck procedures, and this was really to give some additional capacity to our neighbours, Liverpool University Foundation Hospital Trust. So on the Aintree site, they usually provide theatres and care for patients who have head and neck cancer, Because of the outbreak in COVID and them taking a large proportion of patients, we offered our theatres and our theatre staff to support ensuring that those head and neck cancer patients were seen timely. And I think it's important to say that all of those patients were seen, and we have continued to see all of our cancer patients that have brain or spinal cancers that we treat timely throughout the period. We also, as part of our extension of assistance to Cheshire and Merseyside and the Aintree site in particular, relocated the stroke services. So there is stroke patients based in both Aintree and the Royal Liverpool. And what we did was, again, in a short period of time, transferred one of our wards into a stroke unit and moved all the patients across from the Aintree site. Again, working with the Aintree staff, but ensuring that our staff gained new skills so we could care for the stroke patients in a area that was of a lower risk in relation to COVID, and also to release bed capacity on the more acute site. And the other area that enabled us to take all these actions forward sooner rather than later was our internal command and control. So nationally, we were in level 4, which you'll have seen on Janet's earlier slide in relation to incident management. I don't think the UK has ever been on that level before for the whole of the country. And that was also replicated regionally and within the trust. So all command and control systems mean that you make decisions much faster and go through a operational process to do that. And that helped improve our grip and control and the speed of the actions that we undertook. And finally, in this slide, we looked at the agile working of our staff. So not just making sure that some of our staff could work off site, but enabling them to do so safely and be able to access all the information that they need, making sure there's good connectivity, and then most importantly, appropriate information governance procedures so that we could exchange patient information safely, and to ensure that we had a new way of working across the site, reducing the amount of people coming onto the site, and so reducing the risk to our patients and the staff that needed to be here. And we'll talk a little bit more about that later. We go to the next slide, please, Carol. Thank you. We also looked at our internal relocation of our services. So I talked earlier around moving Jefferson, our day case ward, and we moved that over to the Sid Watkins building, and we commenced an infusion bay so that we could treat some of our patients who require ongoing treatment on a regular basis and still be able to continue some of those treatments whilst we were caring for COVID patients in the main building. That ensured everything that was essential continued, and it also ensured that it was in a lower risk site, which was really key to ensuring that whilst treating patients for one thing, we weren't increasing their risk of COVID-19, particularly given some of those are our patients that are autoimmune compromised and so at a higher risk. We also overnight changed all our meetings to virtual. So we use Microsoft Teams in the main, but have used Zoom and some other areas for our staff communication and meetings. So all meeting in the same room stopped pretty much overnight to ensure that we were not increasing the risk of spread by people being in small rooms together or 2 meters apart, but for a long period of time. We also upgraded our IT. And that enabled us to ensure that our Attend Anywhere clinics ran more smoothly than they would have done previously. And it also allowed us to expand our services to ensure that we had a better stability around those networks. We also ensured that we had an early cancellation of elective activity so that our patients weren't wondering what would happen. So we implemented this mid-March as instructed nationally, and this created the capacity that we needed for those urgently to be seen patients with COVID. And at that point, I think it's fair to say we were still learning about the COVID disease and how to care for those patients and which were the areas that we needed to be more skilled within. In relation to ensuring infection control and prevention, we also overnight had to ensure that our PPE, so the protective equipment that we utilise to prevent infection, was changed overnight. We worked across with Cheshire and Merseyside trusts to ensure mutual aid as we received batches nationally and regionally of masks, of gowns. Often these weren't always delivered to the right place or at the right time. And it was working with our neighbouring trusts to ensure that every trust had the required PPE to support their patients. We implemented through the command and control with our procurement team, who were incredibly proactive during this time, twice daily top-ups so that all staff were aware of where the shortages were and how we moved to different masks and PPE as different brands came through. And we continue to ensure that we had training in relation to each mask as they changed as they came through, which was really key to keeping our staff safe and our patients safe. We also overnight had to stop relatives coming in. We normally encourage open visiting and for people to spend time with their relatives and be involved in their care, but to reduce the amount of traffic within the trust and therefore the risk, we stopped relatives coming into the trust with the exception of a few key areas. So patients who are at the end of their life, patients with learning difficulties and so on. And we had to improve the family communication and worked with our specialist nurses using some IT and phone calls, which I'll come on to later, to make sure that relatives still felt informed, even though they weren't able to see their loved one face to face. And then the stability of the COVID patients, that we accepted. So as I've said, they weren't patients with neuro conditions, but patients that came from Liverpool University hospitals, and we needed to create the ITU capacity for them for the very complex patients, but also to make sure that ourselves and the other specialist trusts were able to play a key part in managing critical care patients across Cheshire and Merseyside, and that no patient that required critical care didn't have a bed. If we move on to the next slide, please. Just bear with me one moment because my logout has disappeared. Thank you. We're going to share with you, if we are lucky with digital and it's behaving itself, a walkthrough video of some of the changes that we've made for infection prevention and control for our patients to really help them understand how coming into the hospital will be different, but also safe as we return to some of our normal activity. So over to Alex now, who I think is going to help us make this play. Thank you, Alex. You may have to bear with us whilst the sound comes on, but as you can see, there are subtitles for this.
The sound didn't come on in Quality Committee, Hayley, so it might not come on.
Okay. Thank you, Alex. So I apologise for the sound there, but I think it will have given you a flavour of how we've increased our infection prevention and control measures in relation to the COVID-19 requirements. I think, as you'll see later on in the year just gone by, it's an area that we've always been strong on, infection control, but obviously with the COVID-19 we've had to increase those measures further. And we've had some positive comments from patients and relatives since that video has been on the website, that it made people feel that it was safe to come back to hospital, which is important for those patients that require treatment on site. One of the areas that was a positive in relation to COVID-19 was the public's response to the NHS and wanting to support us, and the Walton charity, led by our head of fundraising, Madeline Fletcher, we set up an emergency appeal in response to the public's requests to support the hospital and the wider NHS, and we raised over 15,000 in relation to our donation page, and we also received 2 grants from NHS charities together, which we have been a part of for some time now. We utilise this, as you can see in the pictures here, in a number of different ways. Small gifts for staff, just things to remind people that people were thinking about them. So we had an ice cream van, we've had Easter eggs, we've had little pamper packs, and I think probably the one that people talk about the most in relation to staff support was Project Wingman, and that's the one that you can see in the top right hand corner where we have got the airline staff, and this was airline staff who volunteered to come and work in the hospital to give us a first class lounge experience. These were staff that were currently laid off work in relation to the fact that they weren't flying because of COVID, and when people went for a break they brought them a tea, they brought them a coffee, a little snack, just looked after them, and that was really well received, and I think was one of the highlights of the events that we held in the Walton Centre to support staff. You'll also see there's a lady holding scrubs, and we had a number of our small enterprises that we work with and places across Liverpool and in the local areas who helped us be able to provide some of the PPE equipment and turn things around for our staff when the national supplies were short, which was absolutely incredible. And I think a key part of being an anchor institute moving forward is how we work closely together with those other businesses. Next slide, please. So that was a reflection on the COVID to date. What I'll share with you now is the more formal part of what we tend to do in our annual members meeting, and this is an update on our strategy. So what we have is a 5-year strategy. It has 6 priorities that I'll come to in a moment, and this was designed 3 years ago now, and we worked with staff, with stakeholders, with commissioners, with regulators, with our patients, with our relatives, and a number of third sector charities to make sure that we were really clear on what people wanted from the trust, what they wanted more of, what they wanted less of, what was important going forward. And we agreed to keep our mission of excellence in neuroscience because that was pretty, that still resonated with our staff and with our patients, which was great. And we agreed that our aim was to have dedicated specialist staff that would lead the treatments and the excellence of clinical outcomes for all our patients, not just in the centre, not just nationally, but also internationally. Next slide, please. And to do this, we recognised we needed 6 ambitions, and these ambitions are to deliver best practice care, because it's not good enough for our families, it's not good enough for anybody else's. To lead research, education and innovation and ensure that we're a cutting edge of that. To be recognised as excellent at all we do, because excellence is what every family should have and every patient and their relatives should experience. To provide services close to home for our patients. Obviously we serve populations in many different areas, so we have a good satellite service where we undertake everything that we can within the local locality, and when we can't, we bring people to the centre for specialist tests and for operations that needed to be done at the centre. To be financially strong so that we can invest in innovative and advanced technology and treatments, which is the 6th category, to make sure that we are supporting our staff by giving the best technology and the best equipment to be able to ensure that we have cutting edge treatments for our patients. And we know that in doing all of this, it's not about what you do, it's about how you do it. So these are our Walton Way values, and making sure that through those 5 aspects that we are always putting others first, we're passionate about delivering dignity, we're open and honest in all that we do, proud of being one part team, and ensuring that we respect patients, their relatives and other staff. Next slide, please, Carol. Thank you. So what we tend to do through the annual members meeting is just highlight some of the key deliverables that we have undertaken in the last year for each of those 6 priorities. So in relation to delivering best practice of care, we've extended our health and wellbeing package for our staff, and we know that if you look after your staff, they are able to look after their patients, and this is there's a lot of research to back that up now, that actually that's a key part of delivering excellence in care. In response to our staff's feedback in the staff survey, we've introduced a programme called Building Rapport for our line managers, and that has been received extremely well. We've also ensured that we've been meeting our equality, diversity and inclusion vision. One of our aspects was to have a more diverse trust board. Last year we had an all-white trust board. We now have a much better balanced trust board with 2 members of Black and Asian minority staff, and our ambition is to increase that further. The other area that we have increased is our thrombectomy service of patients. So this was last year for 5 days a week. It is now 7 days a week, and this is for patients that are suitable, who have had a stroke, that are suitable for a thrombectomy procedure, and this increases their outcomes significantly. We've I alluded to earlier that our infection control results and it was an area of focus for us that we tend to do very well in, and we've had no patients with MRSA for the 2nd year running, and in fact we've had no patients with MRSA, which is one of the hospital acquired infections, since November 2017, which is a significant achievement. And then the final example that we picked out of many is that we were awarded the Surgical Spinal Centre of Excellence by Eurospain. That's a European organisation, and we are the first in the country to be honoured with that award. Moving on to our next slide, where we talk about providing services closer to home. So one of the things we promised we would do last year was to open a new dedicated neurosurgical clinic for patients in North Wales, and we have achieved this, ensuring that one of our neurosurgeons travels to Wales to hold that clinic and only bring in patients to the centre for the surgical procedure. We've also commenced ambulatory care service, and that's to support patients that are attending accident and emergency at both St Helens Trust, so Wiston, and also Liverpool University Hospital Trust on the Royal site. We have now provided a best practice secondary headache patient pathway for all our acute trusts across Cheshire and Merseyside, ensuring that wherever you may come into the service across Cheshire and Merseyside, you will have the same level of service. We also took on at St Helens' request the community rehabilitation service in St Helens from Bridgewater to make sure that the rehabilitation was held closer to home. And finally, and you'll see the picture there, we invested in a new piece of equipment, a new radiology piece of equipment called a multi-tom racks, which is a much more comfortable patient experience, requiring this kind of diagnostic procedure and is much less claustrophobic. Next slide, please, Carol. Thank you. To be able to invest in the type of equipment like the multi-tom racks, you need to make sure that you are making a surplus and that you can invest that money back into your patients and enable your staff to be using the most up-to-date equipment. So for the 2nd year running, we achieved our use of resource rating level 1, which is the best level you can get in the NHS, and generated a surplus, which, given the challenges, I think was a significant success. We also introduced a quality improvement approach to our investments with our staff and our strategy, and that has enabled us to really focus on some patient and family experience improvement work. In relation to advanced technology and treatments, it's also about working with the universities and how we can develop the city's research. So we have worked with the University of Liverpool in the last year and developed the city's first neuroscience department for research, which is incredibly exciting. Furthermore, we also have a theme for neurosciences in the Liverpool Health Partners and are really embedding the joint research service across the Liverpool area. In support of our Anchor Institute works, this is where organisations that are that sit in the communities that can give example of employment by looking after staff and health well-being, by making good procurement choices and working with people locally. We held our workforce safari, and this was working with the Liverpool City region schools and colleges on a career hub, and we had over 200 children attend to come and talk with our staff about different NHS careers, and you can see here the variety of different areas that we covered, so O2, physio, but also some clinical areas and information and analysts and data requirements, as well as administration, which was I think a day that the children as well as the staff enjoyed. Next slide, please. Excuse me. To ensure that we were able to work efficiently, particularly during COVID, we'd increased our bedside technology and our IT, and also at ward level as well, so that some of the areas that we now have as an electronic basis enabled our staff to be able to utilise that more quickly. We use Microsoft Teams to empower new and agile ways of working, as we alluded to earlier. And also we have now agreed a new trust website that will enhance our patient, visitors and staff experience, and that will be going live later this year. Next slide, please, Carol. And our final priority in relation to recognising excellence in all that you do, one of the things that's really important is joined up working, and we're working in relation to workforce with our local council, Liverpool City Council. So this is a strategic workforce partnership that we have that's co-chaired by ourselves and the Liverpool City Council, and in particular focusing on areas such as healthcare assistance. One of the key points of last year was definitely the successful accreditation of CQC to be outstanding again, and I will come to that in a moment. And our inpatient survey, which we've just spoken about in our Council of Governors meeting, again a very strong inpatient survey, and we were actually 6th in the country out of all the UK trusts, which was a phenomenal recognition of how our staff care for our patients. We also saw year-on-year improvement in our staff survey, and that showed significantly high marks in our staff health and wellbeing, and that enabled the package that we had to be built on during COVID. We've also seen year-on-year improvement in our RES data, that's our workforce race equality standard, and that's really important to ensure that we are progressing in the right way around equality, diversity and inclusion. Next slide, please. Thank you. So partnership working, I've alluded to earlier, is really important to the trust. So we are currently working with the University of Liverpool looking into the neurological effects of COVID-19, and again in our Council of Governors meeting we've just spoken around one of the professors and his team working in relation to this and some of the new conditions that we are seeing, or some of the new symptoms I should say that we're seeing in relation to COVID-19. I think given how it has taken over our lives, it's easy to forget that actually we're still learning about COVID-19, given the fact it's actually only been with us for a few months, even though it feels much longer. The temporary hosting of the region stroke services talked to before, and also the head and neck cancer services is really important to make sure not just neuro patients were seen as timely as we were able to, but other high risk patients. We've also had through the year some challenges, I think, both nationally and globally in relation to equality, and in particular to Black and Asian minority ethnicities. And I think we've seen this in the killing of George Floyd in America, but also in the disproportionate outcomes for BAME staff and patients in relation to COVID-19. And both nationally and regionally, the NHS have recognised how important it is that we play a key part in improving that. And 2 of our non-executives are now part of our Northwest Strategic Regional BAME Advisory Committee, so they can be part of that group. And I'll come a little later to what we're also doing within the trust in relation to that. We're working collaboratively in the region with COVID-19 rehab services, so this means we've reviewed the admission criteria for our rehabilitation beds to enable to incorporate some of the patients with who've had long-term COVID that are requiring a more specific rehabilitation. And as I mentioned before, the mutual aid with the protective equipment has been really vital and will be again. Next slide, please. Thank you. So this was a really joyful part of last year, and it's hard to remember that some things were joyful, where we're celebrating with our staff, I should say. This is pre-COVID, as some of the other pictures were that are on these slides, so you won't see the social distancing. And this was us celebrating that we had been awarded Outstanding again. And the next slide will just give you an overview of the assessment of that. So in 2016, we'd been assessed as outstanding. In 2019, we were assessed again, and as you can see, we remained outstanding. In actual fact, we have built on the number of outstandings since the first inspection, and the comments, I think, were also really key for us. So recognising candour, openness, honesty and transparency were the norm. The excellence in patient care, people going the extra mile for patients, was a daily occurrence, and a number of other areas that I think just recognised the work and the dedication of the staff at the Walton Centre to ensure that we give patients the best care that we can. And we remain, I think, one of the few, if not only, hospital with no areas of requires improvement in any area at all. Next slide, please. Some of the other areas to highlight, so we have implemented some new pathways of best practice in relation to patients suffering acute headaches, Parkinson's disease and post-seizure, as well as patients with multiple sclerosis. This is working with all the areas in Cheshire and Merseyside, all trusts, to make sure we're all using the best practice. We've also procured a new 3T wide-bore MRI scanner. This scanner works faster, so it's better for patients, but also because it is wider, it's more comfortable, and those patients that are claustrophobic find that a better experience. And you can just see the picture of that on the left there. In relation to neurosurgery, we developed an alert pager that won our Roy Ferguson Award. And this was for patients' relatives who were waiting for patients to come out of theatre or a procedure in critical care, or if their patients had deteriorated in critical care, it was a pager to alert them so they could go for a break and feel comfortable that if there was any change, they would be notified immediately. And then in the centre there, you see a picture with our Metro Mayor, Steve Rotherham, who kindly came to open our garden room, which was a facility for our critical care patients. It's access to the very own open door outdoor space, so it enables them to go with all the equipment they require, but into an area where there is plants, they can feel the breeze on the face, they can feel the outside air, hear the birds, and it's just for those long stay patients, I think, one, a fabulous patient experience, but secondly, I think is really important in helping orientate patients to time and day, from day from night, and I think for those long-term patients, that's a really key part of their sort of experience on critical care. Next slide, please, Carol. Areas in relation to family-centred care. So there's a number of these, so we picked out one in particular, and this is one of our theatre staff here who shared the approach that they had taken to really enhance the theatres working with patients who had maybe particular religious beliefs or products that they didn't like being utilised, or of a special diet, or in relation to some cultural needs. What we recognised was, although there were some areas that were very good at sharing with patients and their relatives, we wanted to make sure that we could demystify products in the same way, if you like, that ingredients are demystified now in many of the chains of restaurants, so you could be really clear about what was in each product and make a more informed decision. You may have also caught us on the TV. That's one of our neurologists there, Dr. Chrissy Beness, and we were talking there about our complex functional patients and the journey that they often go on and how we help them through that. Next slide, please, Carol. Thank you. So finally from me, I'll just go back to the importance of fighting racism. So I touched earlier on the recent events that have happened nationally and internationally, and as an organisation, we are committed to tackling these important issues and being part of the move forward to redressing the imbalance that we're currently seeing in the modern day society. So we have our Equality, Diversity and Inclusion 5-year vision, and in fact that came to our trust board last month, and we're making good progress on that. What we recognised was that our Black and Asian and minority and ethnic groups, either patients or populations, are at higher risk, particularly in relation to COVID-19. So what we wanted to do was to make sure that we use this as an opportunity to introduce new thinking, new ideas of how we could tackle racism and inequality in new ways, and how we would play our part in ending racism and discrimination and supporting that agenda. And so we are holding our own, which was agreed at Trust Board, our own strategic BAME advisory committee that I'm chairing myself with our staff, learning from staff's experience, learning from our own staff and patient data of where we can improve. So not just taking forward national and regional work, but also learning for what are the key areas that we need to do as a trust based on our staff and patients' experience. So I think overall a successful year. As we alluded to earlier, we've met all our quality account objectives and our financial implications, and have seen a number of good quality and patient experience changes, as well as significant operational changes in light of COVID-19. So I'm going to hand over now to Janet, who's just going to talk a little bit more about some of the areas that are key to the annual members meeting, and then we'll move forward into the annual accounts. Over to you, Janet. Thank you.
Thank you, Hayley. Afternoon again, everyone. We're now moving into the part of the agenda which deals with the formalities that we have to report each year. So engagement with members, financial performance, and the auditing of the both the quality accounts and the auditor's reports on the accounts themselves. I'll start with the engagement with members. As you know, every foundation trust from the date we were set up was obliged to have a public membership and a staff membership. All our staff, I think without exception, are members of the trust. Our total public membership is 5,301. What we're obliged to report to you is that the membership of the organisation is representative of the membership, or potential membership. And I think we've recognised that whilst we have quite a lot of public members, they may not perhaps be as representative as we would have liked. So we've done some work on this to look at whether they're representative, for example, of younger people in particular are very underrepresented. And we've devised a new communications and engagement strategy, which is currently being finalised. And one of the aims of that new communication strategy is to address how we're going to deal with underrepresented groups of patients. And then there's a new Council of Governors membership group being set up, which is going to take forward that engagement strategy. So that's all I want to say at the moment on it. It's not a fixed number. But as I say, we're more concerned not with necessarily having more numbers, but with making sure that our membership is truly representative of the public that we serve. OK, thank you for that. Annual accounts. Mike Burns, Director of Finance, is now going to talk us through the annual accounts. Mike.
Thanks, Janet. As Janet said, I'm Mike Burns and I'm Director of Finance, and I'm just going to give you an overview of financial performance and then a couple of slides on a little bit more detail. So can we have the next slide, please? So in terms of financial performance, as Hayley mentioned earlier, we were obviously very successful in 1920. So we made a surplus of just short of 4.8 million. Which overshot our control total, which was what NHSI asked us to contribute to. Just to give you a bit of a flavour of that, that was the highest control total in Cheshire and Merseyside. And although we did actually achieve it, it was quite challenging during the year. We were helped by a settlement with NHS England. But what I would say is, it was really great performance to actually get to that sort of level of surplus in 1920. So we really a thank you to all the staff that helped us to get there in the end, because it was, you know, although it's a success at the end, there's a little bit sometimes a bit of a bumpy road to get there. But again, an excellent financial performance. And just to say as well, we've achieved every controlled total set by NHSI since that rule was brought in a few years ago. In terms of turnover, you can see they're increased by 6.1 million. And that is, a lot of that is due to national prices, but that is also driven by the complexity of our patients and the actual cost of treating those patients. So again, that's recognised in the tariff last year, and obviously increased our turnover by 6.1 million. And in terms of the surplus, we actually did have to use some of our non-recurrent items in 1920. Some of that was due because the quality improvement programme wasn't delivered in full, and that's a theme for all trusts at the moment. And there's also, during the year, there's always some unexpected costs that come up from time to time that we need to cover. And a real success story really was cash balance at the end of the year, which was 26.7 million, which was 1.7 million above our planned position. So again, very good performance in terms of cash. Can we move on to the next slide, please? Hayley mentioned before, our use of resources rating was a 1. It's continued excellent financial performance. Again, it continues the last few years and delivering the lowest level of risk. As we sit here now, we are awaiting the new financial framework and what the requirements will be under this. So again, I think what we've got to do is hold on to the fact that we've always been a great financial performer as a trust, and see what the challenges ahead. Can we have the next slide, please? So, as I mentioned before, in terms of cost reduction and efficiency, all trusts have really struggled with this last couple of years. But what I would say is, when we do consider our cost savings and efficiency programme, we make sure that there's no adverse impact on patient safety, quality or experience. And as you can see there, we delivered a lot of our savings through the procurement of goods and services. We did deliver 1.4 million, but that left us with a 1.5 million pound gap, which again I mentioned earlier that we had to recover some of that through non-recurrent means. But what I would say is that we've created a service transformation team, which is really helping us now to focus in on specific areas, which is helpful, and they work across the trust and are already identifying areas for us to review. And I would also say that we are working with some of our neighbours, our specialist trusts, in terms of corporate areas as well, to see what opportunities we can do to look at efficiencies. And that includes simple things like where vacancies come up, how can we support each other. Can we move to the next slide, please? So in terms of investments, this is the capital investments the trust has made over the last year. So you can see the big investments there. And again, Hayley mentioned this earlier, the replacement MRI scanner was a 1.8 million pound investment. We were actually provided with additional funding in the year by NHSI, or I would say additional capital resource limit. I won't go into the detail on the technicalities of that, but what it did do is it helped us to actually purchase the scanner. The pipework scheme, again, a big chunk of our capital went on that, 1.2 million, and that's a longer term scheme, looking to replace the heating in the trust over the next 4 to 5 years. So we'll see that in the capital programme going forward. And again, these are significant investments in digital and IM&T, clinical systems, and the relevant architecture around that. And we continue to move towards the full electronic patient record with this investment. Can we move on to the revenue investments? Thank you. I would say again that we've been successful in being able to invest about 0.7 million, obviously 0.4 million in clinical staff and 0.3 million in support staff and staff that will support us going forward with some of the strategy that Hayley went through there. What I would say is that as we move towards block contracts, this may become more challenging. So really, again, we need to focus on the quality improvement programme to free up resources going forward to make sure that we can continue to invest in our staff. And that's me finished on that one, I think.
Okay. So I'll take the. Shall I do quality accounts? Yeah.
Yes, please. Lindsay Blasman, our Acting Director of Nursing and Governance, is going to talk about the quality accounts for 2019-20. Lindsay.
Okay. So if you take me to the next slide, please, Carol. So these are our quality accounts again for 19-20. So they're from last year. We picked 9 quality accounts, and we have 3 under each heading of patient safety, patient experience and clinical effectiveness. So I'll just give you some of the highlights that we chose for this presentation. So we implemented aseptic non-touch technique. We trained key trainers around the trust within each clinical area to be able to cascade the training back to the teams and make sure that everybody was competent, and add a competency assessment document within the folders to ensure that they were able to deliver aseptic non-touch technique. For patient experience, we introduced patient and family centred champions, and this is a group that focuses on improving patient experience. We meet monthly. There's lots of ongoing projects being done through this group, and we're making, you know, lots of headways on improving patient experience. Under clinical effectiveness, Caroline Finnegan's team, they done a piece of work around reducing DNAs, and these are for patients that come in to have telemetry tests undertaken and sometimes don't attend. So it was just as simple as texting patients before they come along for their appointment to ensure that they're still attending, and we have seen a massive reduction in DNAs because of this. So these were our accounts for 19-20. We did meet all 9 of our accounts, and we've chose our quality accounts for 2021, which we bought through Council of Governors a while ago now. We were due to present the quality accounts in April of this year, but obviously COVID hit us. So we will be presenting our new quality accounts for this year in October. However, we have started the work already for each of the accounts, and we are making some good headways on each one. And that's everything from me.
Thanks, Lindsay. So the final formal part of today's meeting is the auditor's report, and we have, I hope we have, Andy Eyre from Grant Thornton, who are our external auditors, to report to the annual members meeting on their findings. Andy?
Hi, yep, thank you. I'll just briefly run through the main findings of our audit. So we completed the financial statements audit in between April and June. The deadline was extended from the end of May to the end of June due to COVID-19, and all of our work was carried out from home. We didn't this year. Normally we'd audit some of the work indicators in the quality accounts and review those, but due to the difficulty of completing that during the early stages of COVID-19 and lockdown, we didn't complete that work this year. The audit opinion was issued on the 25th of June, which was the deadline day. The overall opinion was unmodified. The opinion is made up of a financial statement, true and fair opinion, a value for money opinion where we didn't find any weaknesses to arrangements to get value for money, and we also comment on other information, and that was consistent with our knowledge of the trust and the work of the audit committee. Within our audit opinion, we did add an equivalent to an emphasis of matter, which for Foundation Trust is called an elevated key audit matter, and this was to draw the attention of users of the accounts to the material valuation uncertainty disclosures within the accounts relating to the valuation of land and buildings. This isn't saying the accounts are wrong, it's just flagging that due to COVID-19 there was valuers were flagging there was some uncertainty about their valuations, and this isn't unique to the Walton. It was common to all of the trusts for Grant Thornton audit. Certainly I can't speak to what the other auditors did for this. The accounts themselves were generally a very good standard, and we didn't find any adjusting or non-adjusting misstatements, though there were some minor disclosure and classification improvements that we suggested that were taken on board and amended for the final set of accounts. Thank you.
Thank you, Andy. Okay, final thanks. I said at the beginning of this that I would remind you again that unfortunately we've not been able to take questions during this AMM as we would normally do. But if you have any questions arising from anything that you've heard today, please do send them in to us. The address, I told you at the beginning, I'll just reiterate it, is membership@thewaltoncentre.nhs.uk. So before we close, I'd just like to start with a thought. We started this meeting with a reflection on last year's annual members meeting and how this year's has been a much different experience because of COVID. But during the course of this meeting, we've also reflected on the immense amount of support we've had as a result of COVID. We've also reflected on, despite it, we've managed to update our strategy, keep up with where we wanted to be, and despite COVID, we've continued to build on the ambitions that we set out in that strategy. We've had a strong financial performance. Our activity has been where it should be, so treating the patients, which is paramount for us, has been where it should be, and our quality parameters have been met. And I think those latter things really reflect the strong performance of the executive team in this organisation. But I can't end today without talking about the staff, because undoubtedly it's the staff who've been immensely affected by this last 12 months. They started off on the high of the outstanding, and then very quickly were put in a position which I think a lot of staff should never be put in. For the frontline staff, that has meant working in situations they've never worked in before. They've been under immense pressure, not just at work, but at home. We've all had, I can't speak personally because I don't have young children, but trying to work from home with young children around you cannot be underestimated. So for the frontline staff, it's been a difficult transition into the new world. And for the staff who've worked from home, and I think Hayley quoted the number of 400 or so who've had to work from home, it's been, again, a very different experience, and I think it reflects on the values and the staff that we have, that they've responded so well to this unprecedented situation. Unfortunately, it's not going away. I think we've all kind of normalised it a little bit, but we've moved into a more, as Hayley referred to, agile working, where we hope to be able to bring staff in on a more regular basis. Some people prefer working from home, and again, I think it reflects well on the organisation that we took feedback from staff part way through about how they were coping with working at home and adjusted our policy and the way we worked accordingly. So a huge thank you for all of that effort. It's been a difficult year. I hope I'm not sitting here next year saying the same thing. And I hope next year we will be able to have a face-to-face meeting with tea and cakes, because I don't know about anybody else, but it really is a bit of a highlight for me of the AMM. So thank you, everyone, and thank you for attending.
Thank you.